All right, let's get started for patient assessment review. Everybody got their clicker? Everybody got their group leader? All right, the group leaders are the ones who are going, no hush. The group leaders are the ones who are going to ask for whatever number, whatever category, whatever they want. And they're going to be the ones to hit the clicker button, but everybody needs to participate and make sure that we're all on the same page.
What if you can't show the other clicker?
Is there somebody else with another clicker? Oh, yeah, that's out there. All right, everybody pick their team. 1, 2, 3, 4, 5, 6, or 7, whatever lab group you are. Hey, this makes it a lot easier. I only see 7 responses. All right, team 1. Lab group 1.
We would like a final 8 for 1,000.
All right, this respiratory cycle begins when the lungs have achieved normal expiration and the pressure in... That makes no sense.
No.
It's asking about the pressure inside the thoracic cavity at the end of the respiratory cycle.
Thank you. That could have been worded a lot better.
What is it supposed to say?
Yeah, what's it supposed to say? It's asking, like, is it inhalation positive or negative or exhalation positive or negative? This is talking about exhalation.
Why is it worded like that? I don't know how I did that. Let's just see what the answers are. Hold on. The respiratory cycle begins when the lungs have achieved normal expiration and the pressure inside the thoracic cavity is what? Okay? The respiratory cycle begins when the lungs have achieved normal expiration and the pressure inside the thoracic cavity is what? So when does the respiratory cycle begin? What is the pressure like in the thoracic cavity at that time?
Okay.
Does that make sense now?
When it begins?
Yes, when it begins.
Wait. Expiration or inspiration? Say it one more time. Is it asking?
Is it during the
Hold
very
on,
beginning
go
when you're
back.
about to breathe or breathing out?
All right, let's do it again. The respiratory cycle begins when the lungs have achieved normal expiration and the pressure inside the thoracic cavity is what? All right, let me reopen it. There we go. It's hot in here.
I don't really understand what you're asking. Well, I'm pretty sure what let's say it's breathe out
When the respiratory cycle begins, then everything's out.
Okay.
Then a new cycle begins.
That's what you're asking.
What is the pressure like then? Right then. Because the respiratory cycle ends with expiration, and then the new one begins. So when the new one begins, what is the pressure inside the thoracic cavity?
Okay. There we go. Yeah.
Exactly. It's supposed to be very hard.
Are you saying when you expirate or are you saying when you...
All right, I'm going to explain it one more time. Y'all listen. Sam, correct me if I'm wrong. When you breathe out, that's the end of a respiratory cycle. When the new one starts, when you are about to breathe, what is inside the thoracic cavity? What is the pressure inside doing at that time? You breathe out, that ends the respiratory cycle. Right as you are starting to inhale, right before you do that, what is the pressure like in the thoracic cavity at that time? So everything's out. What's your pressure like right as you're starting a new cycle? Thank you. I didn't say that. Everything's equal. Everything is completely equal. Because there's nothing in there, so there's nothing else to push out. Everything is equal.
Breathing in is negative. Breathing out is positive.
It's a horrible question.
Yeah, because you don't know exactly what.
I didn't write these airway questions. And I don't really like that question.
You didn't write that one?
No.
Thinking when they're about to breathe out.
No. It's being recorded right now. All right, group number 2. Who is responsible for controlling traffic, managing bystanders, and containing any violence at the scene? Any scene you're called to, who's responsible for controlling traffic, managing bystanders, and containing any violence?
What did you just say? Oh my gosh, you just cussed.
Oh my goodness.
I ain't never heard that.
When you said that.
Kane. Y'all are very smart, law enforcement personnel. Number 3. That was an easy 100,000-point question.
When you word it right, it's easy. Final for 1,000.
You're not group number 3.
Well, that's what it's going to be. You might as well go down the road.
A 23-year-old male is overdosed on heroin and is unresponsive. What is your first action? You have a patient who's unresponsive from an overdose on heroin. What's your first action? Intubate. Not a choice. There's somebody who hadn't responded. This shouldn't be that difficult.
See, these questions are so hard.
Y'all are so smart. Assess the airway. Back to your primary assessment, A, B, C. Assess the airway. Group number 4. Which of these medications can be administered down the ET tube? Oh, the cat on Puss in Boots. Which medicine can be administered down the ET tube? Which one can be administered down the ET tube? Atropine is correct. What are the other drugs that can be administered down the ET tube? Lidocaine, Epi, atropine, Narcan, also known as lean. Lean. Are we going to go with D, 1005?
Yes.
EMS called the scene of an MVA where a vehicle has struck a tree at an unknown amount of force. What is your first action once you establish scene safety? All right? MVA where a vehicle has struck a tree at an unknown amount of force. What is your first action once you have established scene safety? Okay? You got your BSI on, the scene is safe, the ignition's been turned off, or the battery cable's been taken apart, whichever one you want to do. What's next? Then your fire personnel did it for you. Y'all are so smart. C-spine.
We're no nursing students.
I know. Wow. You know Hunter dates a nursing student, right? Sure. Group 6.
We're going to go E for 8.
Wait, aren't you going for nursing? Yeah.
I'm going back.
He just likes to give me grief. All right, here's your daily double. This Jeopardy game is for final points, by the way, so
Give it all.
for points on your final, extra final exam points.
Overall,
No. I am not at liberty to do that. I am not at liberty to do that. That's a really doggone good question.
everybody gets the same one, right? The same one.
Give you all 13 points? There's a lot of you that don't deserve 13 points.
I didn't live in the family.
You do? You think? Really?
I think most of us deserve it.
Alright, here we go. Listen up. What is the transfer of oxygen and carbon dioxide between the capillary red blood cells and the tissues called?
Got it.
Transfer of oxygen and carbon dioxide between the capillary red blood cells and the tissues.
It is inhibited by fresh frozen plasma.
This is a term. Which one is it? What?
What's the question?
The question was, it just went out of my mind.
What's the exchange between?
Exchange between red blood cells and the tissues, the capillaries.
At the osmotic.
What was the question? Somebody help me because I don't remember.
It's transfer of oxygen between red blood cells and tissue.
The transfer of oxygen between red blood cells and tissues. Oxygen and carbon dioxide between red blood cells and the tissues. Are we good? Y'all are so smart. It's known as internal respiration. What's external respiration?
In the lungs.
In the lungs. 7.
Why not 800 feet?
A patient starts to choke on a piece of steak while you're out at dinner. You notice the patient coughing. What is your first action? What is your first action when you notice someone is choking but they are coughing? A patient is choking and they are coughing. What is your first action? To get the steak out and then dip it in some A1 and I love his steak.
How old is our patient?
They're an adult. Really doesn't matter though. Alright. The correct answer is monitor the patient. Why? Because they still have an open airway. They are able to cough, still able to pass air. So it is monitor them. The only time that you start to do abdominal thrust or back slaps is whenever they are no longer moving air. They are not able to cough or speak. Okay? Do you ever finger sweep anybody? No. You never knew a blind finger sweep. Ever, ever, ever. You can visibly see it. To grab it, then you can do that. Unless you're a panicking parent, then you're going to stuff your whole hand down their throat. Group number 1.
A for 800.
A drop in blood pressure of greater than 10 torr during inspiration is known as what? What term is this? A drop in blood pressure of greater than 10 torr during inspiration is known as what? That is correct. 2.
What?
Thank you. You sure about that?
It's not.
What is the first action to take place during scene size up? What is the very first action to take place during a scene size up?
Come on
I'm really having a hard time with this question myself.
I mean, hold on.
Yeah.
You really, this is a good one.
Yeah.
It is.
All right, because since I'm so easy.
Yeah.
Did everybody go with their answers?
Yes.
We have 5 seconds.
Rock on. Let's go. Get it. Get it.
Yes. It is scene safety.
Right around the
You should already have your BSI on at that time.
No.
Yes.
Nobody's driving to the scene with their BSI gloves off there.
Yes, they are.
Say mechanism of injury, number of patients.
3. D for 2.
We're screwed now.
During the disability aspect of the primary survey, do you remember what the disability aspect is, or what the disability is?
Yes.
Remember back to that A, B, C, D? What portion should be assessed? What is assessed during the D, during disability? You sure? Look at Ashley's little face, she's like a little kid. Doesn't she? She's so excited, she's like a little kid. All right, 2 groups. Five, 4, 3. Y'all are so smart. Disability is also known as the neuro. Yep. Group number 4.
You give me whatever you want, CA.
What is the primary survey's most important objective? What are you trying to establish during the primary survey? What is your primary objective of the primary survey? What is the most important objective of the primary survey?
You are rude. Cheaters. Cheating over here.
I think they drank too much.
Smell that?
They've never been this loud before. Got a little Mike's Hard Lemonade in it.
Determine any life threats, because you're managing their A, B's, and C's. That's the most important thing, is to fix any life threats that they may have. Group number 5.
B for 600.
Pick your percentage. Pick your poison.
Everybody takes it anyway. We all do it. Either everybody gets it right or everybody gets it wrong. Everybody gets it right.
All right, there's one more group left. Make sure your clickers are clicked. There we go. What location is necessary to use for a needle cricothyrotomy? Where is this done at? Exactly. The medial aspect of the tibial tuberosity. That makes you sound smarter.
You want to go up here?
Tara said the 50.
What was that? I'm gonna stick it together.
Huh?
Tara said the 50.
The mid-axillary line?
I was like, no, close.
Look, Alex was in these.
I mean, you go all over the wall, you can ventilate.
Is that what we use to treat them?
Yes.
Finish reading
Y'all are so smart.
Everyone got it.
Everybody got the Daily Double that time. All right, group number 6.
Safe system.
What is the first thing a paramedic should do for a patient who is suffering from hyperthermia? What is the very first thing you should do for a patient suffering from hyperthermia?
Yes.
That makes no sense.
Nobody gets this wrong.
I wish nobody never knew. Diamonds.
I have no idea.
Wolf Parkinson.
I did this. I don't know why it says that.
So what's the answer?
This is what happens when you make 2 finals and 2 reviews in one day. Everything runs together. Yeah. Huh? Yeah. Playing My Heart Bleeds for You. So my daddy used to tell me. Oh,
Apparently there was no answer.
Did everyone get it
the
right?
answer. Everybody got the answer right. I hope.
I put.
I can't hear that.
Because Beta think you listen.
Oh my god.
More than one person.
No, that's just one group. Somebody in the group is going to hit somebody else. Because what do you do for a patient who's either hyperthermic or hypothermic? Remove them from their environment. All right, group number 7.
600 or whatever.
When assessing a patient with abdominal discomfort, what is the best position to have your patient in? When they are suffering from abdominal discomfort and you need to assess them, what is the best position? Abdominal discomfort, what is the best position when you need to assess them? While you're assessing them. When you are assessing them, you gotta make sure you read the entire question. When you are assessing them, what position do you want them to be in? All right, 5, 4, 3. It's supine.
That's correct.
Why would you want them in sitting position? Why did you choose that?
You can't separate the flight.
Yeah.
Not for a second. But
Well, once you are done assessing them, you put them in the position of comfort. Okay? But when you need to assess them, you have to lay them down supine. Right? Because you've got to be able to palpate, open it up, expose them, examine them, listen to them. Palpation, you really can't palpate and figure out where the exact pain is if they're sitting in a sitting position. It has to be supine. Group number 1.
600.
Receptors in the carotid artery and in the medulla oblongata stimulate an increased respiratory rate in response to what? So, receptors in the carotid artery and in the medulla oblongata, I can't ever say that word. I think of the water boy every time I say that word. The medulla oblongata. Stimulate an increased respiratory rate in response to what? Everybody read the question? Because I'm probably going to forget what it is when we go to the next slide. So y'all won't forget. Go. I done forgot the question.
It's crazy. It's insane.
Like, automatically, it's gone. All I can think of is medulla oblongata. dum, da dum, 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 dum. All right, that's it. Let's go. The bad thing about it is I do not know this answer because I've done forgot the question.
That is right. That is right. You the only ones that get it
Can
right.
somebody pull their book out?
When your pH goes down, don't you breathe faster and get?
pH goes down, you're more acidic.
Yeah.
Thank you for explaining that. Good job. I'm taking it y'all were the one group that picked the right answer.
We're just having fun.
Yeah, good job. Group number 7.
We got it. We're up. We're up.
Woohoo! Yeah. All right. Group number, what number are we on? Group number 2. The simplest airway management technique in a patient with a suspected cervical spine injury is. The simplest airway management technique in a patient with suspected cervical spine injury is what? The simplest airway technique. Simplest is your key word. Huh? That's not simple.
Yeah.
That's complicated.
It's more effective. Have you heard RSI?
Have I? Yes, we've done it in the ER several times.
Quit dying. You're being selfish.
Oh, so smart. The jaw thrust maneuver is the simplest technique. Group number, what number are we on? 3? Yeah, Ashley did. Huh? All of the following increase a person's respiratory rate except what? So all of these things increase their respiratory rate except what?
Oh, God. I think this is wrong.
All of these increase their respiratory rate except what? Y'all shouldn't need time to think on that. All the other things are going to increase their respiratory rate. Sleep is something that's going to decrease it.
Smooth sailing now.
Still think you should quit dying.
I cleaned house all night in my sleep the other night, and then woke up to a dirty house. I don't know how that worked. I was exhausted though. All right, next. 4.
Anyone you want.
What color should the end-tidal CO2 detector turn if you have good gas exchange?
Green. Green for no.
What color should it turn? Green's not an option, I'm sorry.
It's always right though.
I thought it was purple.
Yeah.
Dark purple.
Yellow means
All right, I'm going to pick one. Here we go. Small gestures of compassion, such as hand holding and squeezing a patient's shoulder, is always appropriate. Okay? Small gestures of compassion, such as hand holding and squeezing a patient's shoulder, are always appropriate. Is this true or false? No. Some patients don't mind it, but others would prefer you not touch them in that kind of physical way.
Do not touch it.
Paramedics note a patient has a prominent sternal protrusion. What is this known as? A prominent sternal protrusion. What is this known as?
Is that it's not scoliosis.
A prominent sternal protrusion.
Yeah, but something feeling
All right, 5, 4, 3. The correct answer is pigeon chest. All right, when you look at all your answers, first of all, what is scoliosis?
it's in your back.
It's in your back, and it's curvature of your spine in your back. So it makes you kind of like twisted. What's a flail chest? When 2 or more ribs are broken. in 2 or more places, and your chest is not, you do not have symmetrical movement.
Pigeon chest or bird chest?
Pigeon chest. Y'all know what a pigeon looks like? They have a big breast area. Their whole breast area is very protruding. Thus, a sternal protrusion is known as a pigeon chest.
Do you see the resemblance there?
The maximum acceptable flow rate for a nasal cannula is how many liters per minute? What is the maximum for a nasal cannula? Huh? There's still a group that hadn't answered. There we go. The correct answer is 6. 6. You're treating a patient with, I can never say that word. Thank you. Which of the following will be the preferred intubation technique?
I know. Yeah.
Which is the preferred intubation technique? You gotta know what trismus is first. All right, 5, 4, 3, 2. No. Nasal into what is trismus? Do you want to put your fingers in a clenched jaw?
You can.
I don't. You can't.
I expected
Out of the intubations that are listed here, the preferred one would be nasal intubation because you're not going to get anything in their mouth. And the other 3. What is the narrowest part of a child's airway? They watch Puss in Boots way too much. What is the narrowest part of a child's airway? Get you a little more like courage. You'll be able to figure it out.
You need a refill over there? Yeah, that's fine.
Cricoid cartilage is the narrowest part of a child's airway. What does the Q stand for in OPQRS? OPQRS, what does the Q stand for?
Yeah. Oh, that was y'all.
Quality. Not quantity. I don't even know what to say about that.
Oh, that was good.
Listen, cognac in the coffee this morning.
I don't care if you have it.
Did y'all really do that?
If we did, it was an accident.
What is an early indication of a patient's mental status? An early indication of a patient's mental status. Early indication of a patient's mental status.
I think genetics should be on there.
That is correct. Their behavior and appearance is the first thing you see. There ready for the scores?
I'm ready for it. Watch my ear. It didn't work yesterday.
Everybody wins.
Where's my roll?
You're welcome for some of those points.
Y'all will take them five.
Lassa, pretty good.
All right, team 2 is who?
The losers.
How are we the losers?
Because you're losers in life.
Wow, that was mean.
Wow. Y'all are
All right, who's team number 4?
The dream
the
team.
losers.
The dream team.
The other losers. You're the first loser.
Actually, I'm the second loser. Didn't get on that board, but whatever.
Make a good loser. So you're the first loser.
Number 6. Group number 7.
We didn't miss a single one. We missed one. But we, well, the daily,
Group number 3.
daily double.
We definitely all of our points.
We did.
Depends on what you miss.
We got all points. What did you think of it?
Yeah, did you miss 1,000 ones?
That's very first question.
What you gotta do is pay the teacher before.
Team number 2 gets 5 bonus points. Team number 4 gets 4. Team number 6 gets 3. Team number 7 gets 2. And team number 3 gets 1.
Half a point.
No.
Take the sheet.
We got four.
And if you have team members that are missing, they don't get any points.
Sarah, I'm not gonna give you.